Hello and a warm welcome to everyone joining us here today at the opening conference of the Healthcare Digitalization Week. It is my great pleasure to be here and to be able to address you at the conference of such importance. Let me briefly start by stating a fact about our healthcare systems. According to the WHO ranking of countries' healthcare systems, European Union member states are at the very top, so having the best healthcare systems globally. However, there is still room for improvement and differences between the member states exist. These exact differences can be used for further development and refinement. In this index, Slovenia is ranked 38th place in the world. However, in our beautiful country, Slovenia, we are often very critical towards our systems, and we tend not to give ourselves credits, even when the credit is due. And when we talk about the digitalization process of healthcare data in relation to the other EU member states, Slovenia deserves some recognition. As we are all aware, in the last year and a half, we have been consumed by the prominent topic of health and healthcare in relation to the still ongoing pandemic. The latter, combined with other global threats such as climate change and air pollution, has brought a light to the need for effective and inclusive multilateralism and coordinated actions at the national, European, and nonetheless also on a global level. Even though healthcare systems data collection has been on the EU's agenda for a few years now, the pandemic highlighted the pressing need for improved data collection and exchange to better monitor and manage public health issues. In the light of the lessons learned from the pandemic, the EU has improved the existing plans for the unification of healthcare in general. Last fall, the Commission put out a proposal for the European Health Union, which was unimaginable only a few years ago. Furthermore, the EU is constantly evolving according to the current events and scientific and technological developments, which led the whole world to the path of the digital revolution. Following such developments, we are striving to combine plans laid down as a base for creating Europe fit for the digital age with all aspects of society, including healthcare. This will have an extremely important influence on the expected European health data space, which was announced in May and will have resulted from coordination between authorities and stakeholders across the EU to agree on a better governance framework to promote a better use of health data, as well as a digital health infrastructure supporting such access. More accurately, the establishment of the European health data space aims to provide a common framework across the EU member states for sharing and exchange of quality health data such as electronic health records, patient registries, and genomic data to support healthcare delivery, facilitate health research, policy making, and legislation. Most EU member states have already adopted electronic patient health records, but they only contain information such as patients' allergies, current medication, and previous illnesses. But these records are not freely accessible to patients yet. With data sharing, there have been many outlined issues connected to the GDPR in force when transmitting the data collected. This will also be addressed in another essential regulation to be proposed in 2022, and that is the use of the secondary health data regulation. It will be very complex as it will involve multiple stakeholders from digital, healthcare, and privacy domains. This regulation will involve various prominent health areas such as European Health Data Space, Pharmaceutical Strategy for Europe, European Medicine Authority Regulation Science to 2025, and Europe's Beating Cancer Plan. The successful implementation of each of these initiatives is dependent on the availability of health data for secondary use cases. It's encouraging that, in contrast to the earlier healthcare modernization policies, these more recent papers are able to identify the other current related bodies of work that are encouraging the acceleration of data and digitally enabled healthcare systems. However, for the implementation of everything planned, the member states will need common uniform standards and requirements, as well as smooth interoperability to enable success, while keeping in mind the differences between the different member states and the possibilities that the one-size-fits-all may not be appropriate for all. There is still a lot to be discussed, but I feel the EU and its member states have a common goal, and it's improving the healthcare systems, enabling room for research and innovation, and providing the best patient care possible. I'm sorry that I cannot be there with you today, but I'm sure the event will be successful, and I wish you all a fruitful discussion.